Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is the basics of celiac plexus blocks. A celiac block is an outpatient procedure used to relieve pain occurring from abdominal conditions like pancreatitis, cancer, Crohn's disease, IBD, and more. It can also help provide diagnostic information, so not only is it therapeutic, it can also be diagnostic. It can prevent the nerves of the abdominal plexus from transmitting pain signals to the brain. What is the celiac plexus? Well, you can see from this picture, it's a bunch of nerves sitting around the aorta that then supplies sensation and autonomic functions to a lot of organs: esophagus, stomach, duodenum, kidneys, pancreas, spleen, liver, and there's a lot of blood vessels that also supply sensation to as well. So who does well with the block? Well, when a person is having pain from one of the abdominal organs, celiac plexus block can relieve it. And as mentioned, pancreatitis, pancreatic cancer, upper abdominal cancer, any chronic abdominal pain can benefit. This is an outpatient procedure. The patient lays prone on their belly on an X-ray compatible table, and local and IV sedation is typically used. Now, as you can see in this CAT scan, there's actually two separate needles that are usually used going through the back, down around the spine. There's the spinal cord back here. So you miss all of that, and it goes into this area where the celiac plexus is. Dye is injected once the needles are in place to ensure that the location is satisfactory. And then numbing medicine is injected, possibly some steroid, or maybe even some phenol, which can provide longer lasting pain relief. The risks of the procedure are small but real. There's a risk of infection, there's a risk of nerve injury, there's a risk of bleeding. I mean, you are right around the aorta. There's a risk of complication from the anesthesia. There's a small risk of a collapsed lung if the needle goes astray, and then a person can have some transient low blood pressure or diarrhea. The outcomes of plexus blocks have been excellent. 3/4 of patients receive excellent pain relief for all types of chronic abdominal conditions. Oftentimes, it's not just one injection, but it may need a series, so one a month for, say, 3-4 months to get the best relief. There was another study done that showed that often the need for opiate medications is reduced. Opiate medications often do not do well for abdominal pain. They simply just don't. It takes high doses, and then you get constipation, and, addiction, things like that. So these are great for reducing the medication needs. The top non-operative management in Washington is through the Washington Pain Network. There are multiple clinics throughout the state accepting over 50 insurances with over 25 treatment options being provided. Over 90% success rates are achieved overall by the board-certified award-winning doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.